This is breaking news on BNC. With the latest information on the global pandemic, in the studio, breaking news host Marie O'Brien.
Welcome to Breaking News. It's been 4 weeks now that the World Health Organization on January 11, 2025 declared a FIC, a public health emergency of international concern. A week ago, WHO Director General Michael van Dijk warned that this disease has the potential to become a global pandemic of yet unknown dimensions. It seems as if we've lost precious time in containing the new virus. To recap, during his stay in Frankfurt between December 19 and December 22, patient X, Jonathan, infected at least 265 people. Many of them boarded planes to foreign destinations where the disease now spreads in record times and is developing into a deadly avalanche. The reason? SARS-CoV-2 virus is much more dangerous than its predecessors. Here are the facts. We now know that the reproduction rate lies between 8 and 10. That means an infected person, even before showing symptoms, can infect up to 10 other people. To put this into perspective, SARS-CoV-2 that caused COVID-19 had a much lower reproduction rate, between 2 and 3. To stop a virus from spreading, the reproduction rate needs to be brought below 1.0. As we get more data from across the world, the WHO now assumes that on average 65% of people who catch the virus actually get sick. Some 40% of them need to be hospitalized, and again 60% of them need to be treated in intense care units. In comparison, during COVID-19, only 10% of infected needed to be hospitalized, of which roughly a third received ICU treatment. What makes these findings even worse is the fact that the virus is more aggressive than the 2019 coronavirus. On average, people who are infected die within 7 to 9 days, and all age groups are affected, from toddlers to highly aged. All this is mirrored in the mortality rate. According to the latest WHO numbers, the mortality rate of the virus is around 20%. That means 1 in 5 people who catch the virus die. In many countries, the situation is escalating as people die in large numbers and public health systems as well as public order starts to crumble. Tonight, our breaking news correspondents Martin Spector and Toni Massalini report from Brussels and Sao Paulo. Let's go to Brussels first. Martin, how is the situation in Europe?
That's a good question, Maria. In many European countries, the health system is about to collapse. From our European network of correspondents, we receive footage that shows massively overcrowded hospitals in literally all countries across the European Union. People are dying on the corridors, body bags are being piling up in storage areas, and mass burials are being prepared to cope with the exploding numbers of people dying from the virus. Let me give you an example to illustrate what we are talking about. Germany, with its 83 million population, now counts 1 million new infections per day. The daily death toll has risen to 50,000. We are witnessing mass burials across the country now, which have a huge impact on the moral of the country. Even though most countries in Europe have taken early actions, large countries such as France, the UK, Italy and Spain now face similar numbers as Germany. We talked to people on the streets today, and you can feel that they start to panic. And let me add one more aspect, Marie. As we speak tonight, the European Council sits together to discuss a coordinated effort to control its internal and external borders. We assume that international traffic will soon come to an end, and also HERA, the EU Health Emergency Preparedness and Response Authority, which was established during the COVID crisis, has been ordered to activate all available resources and move from preparedness into emergency mode. And now back to you, Marie.
Thank you, Martin, for the sobering update. Wait a minute. As we speak, ladies and gentlemen, we've received news that the EU Council has just imposed a Europe-wide travel ban. Also, all international air traffic will come to end by midnight Central European time. But still, let us now go to Sao Paulo, where our correspondent Toni Massalini is following the latest developments. Toni, how serious is the situation in Brazil and in the Americas?
Marie, the situation across Middle and South America is deteriorating rapidly. Due to the traditionally weak public health systems, the death toll of the Frankfurt syndrome, as SARS-CoV-2 has been dubbed here in Brazil, is soaring. Here in Sao Paulo, but also in Brasilia, Belo Horizonte and other cities across the country, the looting and destruction of department stores has set large parts of these cities on fire. People are hoarding whatever they can get a hold on. During the last 48 hours, violent turmoil in cities throughout Brazil have led to the death of at least 197 people. Across the country, neighborhoods start to organize armed militias to defend their homes and families against the mob. As a reaction, President Alberto Rista has invoked martial law and ordered the military to guard and protect hospitals, department stores, storage areas, and critical goods, as well as essential infrastructures. From Washington, D.C., we hear that the newly inaugurated Republican president is fencing off the country and sent troops to the U.S.-Mexican border to prevent mass migration from the south. In his press statement this morning, the newly elected President of the United States made it crystal clear that the troops have been ordered to use force if attacked. And now, back to you, Marie.
Thank you, Tony, for this update. What makes the situation almost uncontrollable is the social media frenzy that is now unfolding across the globe. Since China appears to have only very few cases and has shut its society down quite early in the pandemic, rumors spread that SARS-CoV-2 could be an artificial bioweapon made in China. Meanwhile, the WHO Hub for Pandemic and Epidemic Intelligence in Berlin developed a prognostic model to be better prepared for the following weeks. The model shows how fast the pandemic will evolve in the coming days and weeks if governments and the international community fail to act with resolve. A source from WHO headquarters in Geneva this afternoon told us, if we fail again to act quickly and decisively, the body count will be in the 100 millions. For Monday, the North Atlantic Council has invited the Alliance defense ministers to discuss medical, logistical, and other support for countries in need, even beyond its territorial mandate. Russian Foreign Minister Sergei Lavrov, supported by Wang Yi, Foreign Minister of China, reacted immediately and said NATO would use the pandemic as a pretext to threaten the integrity of independent nations. This was breaking news. Please stay tuned.